right, we are live now. This is Coffee Side Chat Tuesday edition, and we are going live. With me, I have Dr. Gill, and I just want to give a little bit of a background of her as well, and I'm really excited to talk about this topic because it's very, very popular topic, especially now with the quarantine and everything going on. So Dr. Gill is a doctor of psychology and advanced Reiki practitioner. She graduated from Rutgers, the State University of New Jersey, with a BA in psychology in 2009. LaSalle, did I say that right? LaSalle University with the MA in professional clinical counseling in 2012 and a doctorate in clinical psychology in 2018. She had experience working with outpatient and patient clinics with children, adolescents, and adults. Dr. Gill's advanced training in psychology brings a unique and multifaceted perspective that allows her to quickly identify the roots of one's issues. So I'm really excited to talk today. We're going to be talking about anxiety, yes. Which is something that we all experience at least some point. Certainly something that I used to experience a lot more than I do now. So I'm really excited to talk about her approach. And welcome. Thanks for joining me today.
Thank you. Thank you for having me.
Yeah, and we're starting, we do usually have a lag on Facebook, but we're starting to have a couple people start to jump on there. And I first just wanted to start by asking you, how did you get into this line of business in the first place? What made you decide, I want to go get my doctorate in psychology and I want to be able to help people in this way?
Well, so I was very interested in psychology during my BA because of some family dynamic issues. So I wanted to go into family therapy. So that's why I went ahead to get my master's to do therapy. But I quickly realized that I actually liked working one-on-one better with clients. And I also wanted to get more experience working one-on-one. And I also wanted to teach full-time. So I started actually teaching part-time during my doctorate. And so with the doctorate, I got great clinical experience. I loved it. And I realized once I graduated and I was doing my private practice, I realized that I was actually taking more of a coaching approach. So, that was really helping my clients, and I found that I really enjoyed it. So recently I moved away from therapy to coaching. And actually anxiety is something I've struggled with for many years as well. So that's why I picked anxiety. And I would notice that I was doing a lot more work one-on-one with females, and I was really enjoying that. So I went ahead and I started my coaching practice with a couple of clients, and that's where I am today. So I work one-on-one with women who have anxiety. I use a lot of mindfulness, positivity, and spirituality in my work with my clients.
Awesome. So that's great. And from one fellow coach to another, I absolutely love the coaching approach, and even pairing that, like you have that ability to pair it with a therapeutic approach as well. But I really want to dive into this topic because I'm sure people are wondering, and we kind of know, but what's the real definition? How would you describe anxiety? What is that even?
Sure. So anxiety basically is prolonged stress that has like a mental, physical, and emotional toll. And some of the symptoms are like sweating, increased heartbeat, difficulty breathing, difficulty concentrating, difficulty with difficulty with sleep, worrying, chest tightness, and sweating. So there's a lot of physical symptoms, emotional symptoms, and psychological symptoms that go with it, like cognitive symptoms. Yeah. And everybody can experience a range of things. It doesn't look the same in everybody. So it's along those lines. So that's kind of like my basic definition of anxiety.
We like basic.
Yeah.
And easier to understand. Clinical people are like, I'm even thinking to myself, okay, what's the lay definition here? So I know you mentioned stress. We all know what stress, well, we all pretty much know what stress is. We know what it feels like. What's the difference between stress and anxiety then?
So stress is like normal, right? It's actually very adaptive for us. It's a normal response to danger, to threat. It also kind of gives us a kick in the butt to get our work done, to study, so on and so forth. So the difference though is that when that gets prolonged and it starts to happen over, more days than not, over a few weeks or a few months or a few years, that's where the anxiety kicks in. And there's a lot of overlap with symptoms, and there's also overlap in the brain area that's responsible for stress and anxiety. So we have a little part in our brain called the amygdala, and that's where stress and anxiety kind of light up in the brain. So with stress, with the fight, flight, or freeze response, it'll light up, and that's appropriate, it's healthy, it's adaptive for us. But with anxiety, that'll continue to light up, and it's continuous, even when there's not any kind of threat or danger. So, over a course of months or years, then that becomes very difficult to treat.
Yeah. Yeah. And I'm sure a lot of us have been there, especially with work stress, or usually the most often I hear is financial. I'm not sure if that's what you experience as well when you're working with people, but that anxiety related to financial worries, and especially everything going on right now. And anyone who's listening on Facebook or on Zoom, with Zoom, put a question in the Q&A box. And then with Facebook, just type a question below. There's a little bit of a delay on Facebook, so bear with me. If you do ask a question, we'll definitely get to it. But in terms of just knowing, how would someone know that they're anxious? Like, I know you described some of those raw symptoms, but how would someone identify, man, this is something that I really need to work on. This is really affecting me in a way beyond what I feel I have control over right now?
So I would say, like, the standard is really, if it's happening more days than not for more than 2 weeks, then definitely go and get help for it.
Okay. You said more than 2 weeks?
Yes.
Okay. So, and then when we're talking about coping techniques, the most common question I got when I posted a poll on IG was, how do you get it to stop? I had a lot of people phrase it that way as well, as like, how do I get this to stop? I just want it to go away. What would be like the best step or best recommendation you have for that?
So I guess that's a two-part question.
I do that.
So I would say, I get that a lot too, right? In like coaching or in therapy, I get a lot of, how do I avoid it, or how do I stop it? So the goal really isn't to avoid it, because the more you avoid it, the more it's going to persist. And the goal also isn't to stop it, because a little bit of anxiety is always going to be there. So my answer to that is, the best thing to do is to learn effective coping mechanisms for it. So my best tip for anxiety would be controlled breathing. That's something I tell all my clients to practice, and it seems to be really effective and helpful for them. So breathing in through your nose for a count of 4, holding it for a count of 2, and then breathing out through your mouth for a count of 4. And that's something you have to continue to practice, because if you're getting like an anxiety attack in the moment and you try breathing but you haven't practiced it, it's really not going to work for you. And then you're going to think, oh, well, breathing doesn't work for me. So it's something to continue practicing.
Yeah, and that's a really great tip. And I love breathing, because you can do it anywhere. You can do it in your car, you can do it in a meeting, and people don't even know when you're doing it. I like reading your bio and just talking to you. I love meditation too, but oftentimes people are like, well, I mean, if I'm having a moment, like I can't just stop in the middle of my workday in front of a group of people and close my eyes. I'm like, yeah, but that's a perfect technique that you could do on the fly, in the middle of everything, and it is really effective. So you said it was inhale for 4, hold for 2, and then exhale for 4.
Yep.
Okay. Is there any minimum amount of time or amount of rounds that someone should do for that, or does it not matter?
Well, so if you're like in an environment where you're able to kind of stop, I would say do it for like 10 times, repeat it 10 times.
Okay, awesome. And then you mentioned anxiety attack, and that kind of leads me into panic attacks too. I know a lot of people do experience those. What is a good tip if someone is it still breathing? Like because I know with the panic attack, it's like you can't breathe, the world is ending, and you feel like you're gonna die.
Right.
Essentially, that's how people describe it. So would it just be stop and breathe, and use that same technique if a panic attack is coming on too?
Yeah, I would say so.
Okay.
Mm-hmm.
Okay.
Yeah, that's my best tip for anxiety and panic attacks or anxiety attacks.
Yeah. Yeah, that's good. That's good stuff. And then what's a quick mindfulness tip that you might have that would help in addition to breathing, or just in addition to even if it's just feeling that anxiety, what if like you do the breathing and then it comes back an hour later, do you recommend continuing to do the breathing?
Yeah,
Okay.
you could do that. The breathing works. I also like, and I've seen the five senses activity be really effective. So like counting down on your fingers, like 5 things I can see, 4 things I can feel, 3 things I can hear, 2 things I can smell, and then the last sense. So you do that and you can pick 5 out of the 6 senses, whichever works for you. And that is also something you can do any environment you're in. Like you don't have to like lift your hand up and do it. You can just kind of do it under the table, and in your mind really quickly, and that can be really effective as well.
Wow, I really love that. So you said it's called the five senses activity. Okay, cool. Yeah, I really like that. It's almost like why does that, just curious. So is it because it's more of a distraction or more of a moving type meditation focus that someone's doing?
I would say it's more of a distraction and it pulls you into the moment, right? And that's what mindfulness is, right? To pull you into the moment so you're not worrying about the past or future too much.
Yeah, yeah. And I mean, even getting into meditation, it's kind of funny because the way that I used to think of meditation was I would imagine that, I had to lock myself in a room for a whole hour and go through this, the incense burning and everything, or it wasn't real meditation. And it's kind of funny because now I'm like, oh, I just meditated for a minute because I focused on, one plant and nature. So, it's just one of those things that kind of helps you. And I really liked what you said about engaging the senses too, because even going outside and just feeling the wind on your skin can just make all just the little things. And that how you described mindfulness, I really love that. So kind of going into meditation as well, how would you recommend that someone starts, let's just say, a meditation practice if they say, man, I want to take it a step further from breathing? How do they start from there?
So I would say start off really slow and small, like even 30 seconds of breathing or 30 seconds of, like you said, going outside, listening to the birds in the morning, or waking up and just taking 30 seconds to be quiet and silent. So start small, and then you can always build up from there. And it doesn't have to be like this crazy practice for an hour, like you said, where you're burning incense and everything. Just take those moments for yourself. And something I recommend my clients do as well is go to, download an app. They have a lot of good free meditations, mindfulness practices, and exercises. And what I like to use a lot is YouTube for guided meditations. And they have really short ones, anywhere from like 2 minutes to a couple of hours. So build it up, use those apps and YouTube, and, let someone guide you. And I think that can become easier, because sitting in silence can be very intimidating, because people get frustrated, like, oh, I'm thinking, I'm having thoughts, and then they're judging those thoughts. So I would say let the thoughts come in, accept them, don't judge them, and if frustration arises, accept the frustration and don't judge it.
Yeah, I like that, taking the judgment out of everything, and just being, instead of having to do all the time, just be for a moment. I think that makes a big difference. So how do people find you if they're like, man, I'm really struggling with anxiety and I need to work with someone? What's the best way they can get in touch with you?
So I have a website, drrandeepgill.com, or they can reach me on Instagram. My handle is @theserenitydoctor.
Okay. And I will put that in the notes section as well once we're finished. So
Okay.
drrandygill.com and then the Serenity Doctor.
Mm-hmm.
Okay, awesome. All right. Well, is there any closing comments that you have before we jump off? And for anyone who joined late, we went through a lot of really great stuff on anxiety, the difference between anxiety, stress, and then Dr. Gill went through some really great tips to combat that and, bring it back down to being instead of doing and thinking and running around rampant and tunnel vision. So go back once I post on YouTube. If you want to rewatch, it'll also save to the Facebook page as well. And any other closing thoughts that you have, Dr. Gill, for us today?
Sure, just a couple more coping techniques. Journaling is really helpful, exercise and yoga, any kind of purposeful movement like that. Saying safety statements to yourself, like, I'm safe, my anxiety can't hurt me. Good sleep hygiene, definitely practice that, because the more sleepy you are, the more anxious you are, and then the more caffeine you're going to drink, and then more anxiety is going to come up for you. And also having like a healthy, balanced diet.
Yeah, that's really great. Great tips. And again, if you're listening and you feel it's something that you need, don't hesitate to reach out to Dr. Gill. If you forget, reach out to me and I'll get you in touch with her.
Yeah.
All right. Well, thank you so much for joining. I really appreciate it. I know this has been really helpful for a lot of the listeners, and I will talk with you soon. Thanks so much.
All right. Thank you so
Okay.
much.
All right.
Bye-bye.
Bye.